Are you working with a client who may have dissociative amnesia? Are your clients unable to recall important autobiographical information or major or minor events during a period of time? In order to assess for dissociative amnesia, I recommend that my students use the Multidimensional Inventory of Dissociation Scale, or MID. The MID is a self-administered scale that measures 14 major facets of pathological dissociation. This scale examines the subjective experience of dissociation and identifies the symptoms of dissociative disorder, including dissociative amnesia. The clinician should ensure that the loss of memory cannot be attributed to the use of a substance or other neurological or medical condition, such as traumatic brain injury. Because dissociative amnesia may be comorbid with depression, PTSD, or borderline personality disorder, clinicians should ensure that a severe dissociation of memory relevant to an event or period of time or a specific aspect of an event is the identifying component. Differential diagnosis may include dissociative identity disorder, PTSD, acute stress disorder, somatic symptom disorder, or major or mild neurocognitive disorder. In order to ensure that the client has dissociative amnesia, the individual must present with the inability to recall important autobiographical information that should be successfully stored in memory and would typically be easily recalled. Initially, clinicians can use the dissociative experience scale to learn about the client's dissociative symptoms. However, this scale cannot diagnose associative amnesia, but can serve as a tool to know whether to administer the MID scale. Some questions you may want to ask your client can relate to an experience of time loss, experience of depersonalization or derealization, and gaps in memory during childhood experiences. The MID scale has a high rate of internal and external validity and can be used to help identify the diagnosis of dissociative amnesia.